What's up guys, welcome back to my channel. I'm coming at you today with another nursing video. This one's going to be related to your clinical experience. Not so much your long-term care clinical experience, but more so your hospital and your med-surg clinical experiences. I want to kind of give you guys an idea of what to bring and just a little bit of advice and tips to succeed and just make the best of your clinical experience. So I'm just going to go ahead and jump right into it. Starting with what to bring, I always make sure to bring a clipboard. I find it just so much easier to carry around with you. This one you can get on Amazon, and it just has a couple different, like a quick reference sheet for a couple different things, and then it folds so it's easy to carry around. I also have a different clipboard. This one's a little bit bigger, and but it also, you can open it and it has storage. So I kind of put some pens, my Drugbook and stuff like that inside of this. So it kind of depends on if you want something a little bit smaller or if you are okay with something like this. Also make sure to bring an assessment sheet for your patients. I know going into third semester you will be responsible for 2 different patients, so make sure you bring a couple of copies of this. But this one's my favorite. It's just, I like the way it's organized. It's easy to look at. When you're giving report, you can just go right off of this. Go straight down the line, give report. And so up here you have like their room number, their code status, their allergies. Do they have a Foley catheter in? What gauge is it? Do they have an IV? What gauge is it and where is it located? And are they getting any fluids? And then you have like a chart down here for their vitals. Are they on fall precautions? Are they on I's and O's? Just everything you need to know about your patient and what the oncoming shift may need to know about your patient is on this piece of paper. And then on the back you have a little chart that you can write down what their lab values are. So I put the lab values down here in this column, and then the column right next to it I'll put an arrow going up or an arrow going down depending on if their value was above normal or below normal. So I like this. I definitely bring a couple copies of this, and then you'll need to bring a couple different sheets for your care plans. Make sure to bring your pen light. Those come in handy for your head to toe assessment as well as a stethoscope. I always make sure to bring a little mini notepad. This little notepad will fit right into your scrub pocket. This is easy to just carry around with you if you need to jot down a set of vitals, or if you need to jot down urine output or anything. It's just easy to write down and put right back in your pocket, and it comes in handy whenever you need it. Also, make sure to bring a mini drug handbook with you. I know some of the units will have drug books available for you, but this fits right in your pocket, or like I said, you can put it in, this actually fits inside of my big clipboard. It fits right inside. So I say this because you will be passing medications, and your nurse or your instructor will make sure that you're explaining to your patient what they're taking and why they're taking it. So if you are giving Lasix, for example, and you have no idea what it is or what it does or why they're taking it, you're not going to administer that medication, because they're going to look at you like, okay, well, what am I taking? And if you look clueless, they're not going to trust you. And a lot of your instructors will like to quiz you on your medication. So just to have a little drug guide for you right then and there, it's just easy to have and make sure that you know what you're talking about so you don't look like a fool in front of your patient. And then I guess that's it, for what to bring. Make sure you bring a lot of pens, because I like to lose all my pens or leave them in my patient's room, or anything like that. Now we can just move on to just a couple tips to succeed in your clinical experience and make it a good educational experience and just make the best of it. So starting with number 1, just be open to trying anything. I know personally I was terrified. I was nervous to do anything new, even though I had been checked off on my skills, such as IVs or Foley catheters, but doing it on a real person is terrifying for the first time. But you're gonna have your instructor there, a nurse is gonna be there with you. They're not gonna let you hurt that patient. So if somebody comes up to you and says, hey, do you wanna do an IV for me, and you've never done one before, you better go for it, do it and just get it over with, because once you do and you build that confidence in yourself, you won't be so nervous next time. So definitely just be open to trying anything. Don't be nervous. I mean, I guess it's okay to be nervous, but just go ahead and do it. They're not going to let you hurt that patient. Number 2, offer your help. If you are done with your patients and you've done your assessments and you've given all your meds and you're not doing anything and you have some free time, make sure to just go around the unit and ask any of the nurses or the techs if they need help. You know, the techs and the nurses are so busy. Half the time they're running around like chickens with their head cut off. So if you see a tech and they're walking around doing vitals, ask if you can help them. Ask if they need your help with, you know, you can go get a set of vitals for them. You know, maybe the nurse needs an extra set of hands for doing a skill or just anything. Just make sure you're offering your help, because that will, you know, shed light on you and show that you are willing to learn and willing to help, and that will just make them respect you that much more. Number 3, don't forget about bedside manner. I know doing skills gets really exciting and you're nervous and you're trying something new, but they're still a person. So if you walk in and you're just solely focused on, oh, I get to do an IV, make sure you introduce yourself. Make sure you ask their name. Make sure you're just, you know, communicating with your patient. Make sure you tell them, hey, I'm going to be doing an IV on you. You may feel a little poke. Just make sure you're making eye contact with them, making sure that they know you have their full attention, basically. Number 4, make sure you ask plenty of questions. This is your learning experience. You want to make the best of it. Don't walk out of clinical thinking, oh, I should have asked that, or I'm still unsure about this, or just make sure you're asking questions. You know, a dumb question is better than no question at all, and it's better than walking out still just confused or not knowing the answer to something. Just ask questions. That's why you're there, to learn. Also, say on Tuesday you are in lecture and you're learning about kidney failure or heart failure. When you go to clinical the next day, ask your instructor or make sure that you get a patient with one of those disease processes, and then go do your assessment on them, look at their labs, look at the medications they're taking, and it really helps you pull everything together. It'll really start connecting all the dots, looking at a real patient that actually has kidney failure or heart failure. It'll really help you start to understand and actually see it in real person, rather than just listening to your instructor talk about it, you know, through a PowerPoint and stuff. Actually seeing it for real actually really helps you connect all those dots. So that wraps up my advice and what to bring for clinical. I hope this helps you in the long run, and I hope that you guys make the best of your clinical experience, because this is where you are learning a lot. And yeah, so I hope you guys enjoyed the video. Thank you so much for watching. Please click that subscribe button and hit that notification bell so you can be notified when I upload, and I will see you in my next video. Bye!